And legal expert Brydon DeWitt is here with much more on what it all means for you. Thank you for coming once again and helping us make some sense out of this leading up to the election. And since the election, healthcare reform has been the #1 topic that folks have contacted me about as far as the election and really what has resulted. And now Virginia signing on to this federal exchange. What does that mean to the folks watching?
Well, in 2014, the way we purchase health care is going to change. The idea is, originally in the Act, is that each state would establish their own health care exchange, health benefit exchange, which would be a one-stop shop for individuals and small businesses to purchase health coverage. That hasn't quite happened. As of now, 15 states in the District of Columbia have signed on to create their own state exchange. Under the Act, if a state doesn't establish their own exchange, then the federal government will step in and provide an exchange. And so Governor McDonnell has decided, instead of Virginia establishing its own exchange, we're going to use the federal exchange. Really, hopefully it will not be much of a detriment to residents of Virginia, because you'll still be able to go to the exchange and purchase coverage. The federal government has said that the coverage offered through the federal exchange will be any qualifying plan that meets the federal requirements will be offered through the exchange. So you'll go, if you want to purchase coverage through an exchange, you'll go to a website where you can call a call center and get information about the different options and purchase coverage through an exchange, and there'll be a range of coverage options in the exchange. It's likely that in 2014, most people receive their health insurance through their employers, and employers are required in 2014 to provide, if you have at least 50 employees, are required to provide health coverage. And so it's likely the initial impact in 2014 for most of us will not be, there will not be a change, because we will continue to receive our health coverage through our employer.
But then the governor went on to say, too, that there is a possibility that down the road that Virginia may reconsider this federal option here and create its own exchange. What would that process be like then?
Well, if a state establishes its own exchange, it'll either be an agency of the state or a nonprofit or a separate entity, but the state will establish this entity that will be, again, a one-stop shop for insurance. So the exchange will decide which insurance plans qualify under the federal requirements. And states can either have a clearinghouse, which is what the federal government is going to do with their exchange, where any qualifying plan will be offered, or a state can act kind of like a large employer does now, of deciding, these options provide the best value, and they'll negotiate with insurers to get the best coverage at the lowest rates, and there will be a limited menu of plan options. But it will be a state agency or a nonprofit that was organized by the state that will regulate the insurance market in Virginia.
A lot of information. Thank you so much for coming in, helping us make some sense of this issue. Complex for a lot of folks.